Good morning, everybody. Welcome to Capital Health and this morning's event. My name is, I'm Dr. Janice Diaz Alvarez, and I'm a general OBGYN here with Capital Health OBGYN, caring for the patients in Trenton community for 6 years next week. I've spent several years caring for women and their babies in Camden, in New Brunswick, and now in Trenton. And I cannot stress how important it is to receive quality care throughout pregnancy, during labor, delivery, and postpartum. I know how critical it is to have available this care for our lower income status communities. I know firsthand because I also grew up in a similar community, and I can identify with my patients on a daily basis. When we talk about providing quality care, equitable, and a fair playing field to our patients, I'm referring to the care we provide for mi hermana, mi hijas, nuestras mujeres, all of our women. Already, Capital Health accepts Medicaid in all of our medical group OBGYN practices, recognizing the importance of high-quality, accessible care across the board for all women of every background, giving them access to all of our resources available in our institution. It is gratifying to know that our state leaders share this commitment to our most valuable patients. Increasing Medicaid reimbursement rates reiterates the Murphy administration's commitment to our maternal and infant health care and the hard work that we put into their care as their providers. It is now my pleasure to introduce a strong advocate for women and their babies, and someone who has made their well-being her signature priority. During her tenure as New Jersey First Lady, Ms. Murphy has tirelessly advocated for the residents of New Jersey, particularly its women and children. Her Nature New Jersey initiative demonstrates her commitment to ensuring equality in maternal and infant health care outcomes for every woman, regardless of their socio-economic status, and to reduce the overall maternal and infant maternal mortality and morbidity in our state. We applaud her vision to make New Jersey the safest and most equitable place in the nation to deliver and raise a baby. And we are pleased to welcome her here today. Please join me to welcome New Jersey First Lady Tammy Murphy.
So I want to thank Dr. Diaz for that introduction, as well as your commitment to New Jersey's mothers. I also want to make sure that we all know that Dr. Diaz has apparently just finished 24 hours of work. And the fact... So talk about a commitment. I think that she's putting her money where her mouth is, so thank you so much for being here and for that introduction. I want to recognize our outstanding Commissioner of the Department of Human Services, Sarah Adelman, and Senator Shirley Turner, who is a legislative champion. She's a legislative champion for New Jersey's families, as well as Julie Blumenfeld, Tanique Griffin, two outstanding maternal care providers, thank you both, from whom you will be hearing in just a few minutes. Before we get to the details of today's announcement, I'd like to point out the entrance to the NICU through those doors are just some of the thousands of mothers and babies who will directly benefit from long overdue changes I'm about to share. And of course, I want to thank President and CEO Al Magazi and all of Capital Health for both hosting us and for providing such a meaningful setting for today's event. So thank you so much. I also have to add that my incredible Chief of Staff delivered her beautiful baby, Sophia, here at Capital Health just over a year ago. So this is a particularly important venue for my awesome team. So thank you. Thanks for having us. So without further ado, I am thrilled to share that through the $15 million provided by my husband in the fiscal year 2023 budget, Family care, New Jersey's Medicaid and CHIP program, is substantially increasing reimbursement rates for perinatal, midwifery, and community doula care. And furthermore, that these increases are retroactive as of July 1st, 2022. To really put this into context, this will more than double the reimbursement for an OBGYN or midwife from $300 to $861.78 for a natural delivery, matching 100% of what Medicare reimburses. This increase in funding is a direct representation of our values, both for the work of maternal care providers and for the lives and well-being of our mothers and babies. While long overdue and common sense, these increases are also groundbreaking and make us the leader in the nation for reimbursement rates. So bravo, and Shirley, thank you for everything here. So much of what we have learned through Nurture NJ has proven that New Jersey's maternal health crisis is complex and interdependent on a multitude of issues. Yet some causes were incredibly simple. With reimbursement rates for Medicaid patients significantly lower than private insurance, many healthcare providers chose not to see those patients, limiting the pool of available providers. And those who did would need to see many more patients a day for obvious reasons. I have heard from countless moms across the state about this experience from the patient side: difficulty in finding appointments, long hours in the waiting room, and less time with their providers, who often were overworked and understaffed. In New Jersey, 30,000 mothers are covered by NJ Family Care, making this experience all too common. If these seem like simple inconveniences, they're really not. Anyone who has ever been pregnant remembers the toll it takes on one's body: the fatigue, the nausea, the endless list of questions of what is normal versus what is of concern. Pregnancy is clearly a special time in a mother's life, but it is also a fragile time. Arriving at a doctor's appointment at 10 a.m. only to be seen at 3 p.m. can only cause distress and discomfort at best, and at worst, a rushed appointment where questions are not answered and warning signs of complications are missed. Our maternal health providers are there to support each mother and baby through pregnancy, labor, delivery, and postpartum. These enhanced rates will not only attract more providers to see more New Jersey family care patients, but also will reduce the workload of those who already participate, allowing for a better quality of experience for literally everyone involved. Sometimes the steps that Nurture NJ takes to improve our state's maternal health landscape are complicated, and sometimes they are direct and simple. Today, with combined state and federal funding, we are able to make a straightforward change with the potential for significant improvement in our maternal health care. And the message we hope to send to every mother and baby is that regardless of what insurance you have, your life, your health, and your baby matter, and we are going to ensure that you receive the highest quality care. What is more, we are shouting out to all OBGYNs, midwives, and community doulas that we value you and your work. I want to thank everyone involved in bringing this funding to fruition, especially our partners at HHS and CMS. Step by step, as Dr. Diaz said, together we are going to make sure that New Jersey is the safest and most equitable place in the country to deliver and raise a baby. Thank you.
Good morning, everyone. Thank you so much, First Lady Murphy, for your unwavering focus on maternal and child health.
Okay.
Here, do you have one? Okay. Thank you, First Lady Murphy, for your unwavering focus on maternal and child health. Thank you for making this your platform issue here in New Jersey and nationwide at the National Governors Association. I'm incredibly grateful for your support, and for Stephanie and Lauren on your team. Your support has made it possible for our administration to make significant improvements in our Medicaid program for 5 straight years. And thank you to our colleagues at Capitol Health for hosting us and welcoming us here today, Al and Kelly and all of your staff who are with us. I also want to shout out Dr. Herb Conaway, our chair of the Assembly Health Committee. Thank you for joining us today. And several other partners to our Medicaid program in the audience. We have many representatives here from our Medicaid managed care organizations, from hospitals across the state, and our partners at the Healthcare Quality Institute. Thank you all for being here. Our shared goal is making transformational change in New Jersey to support mothers and babies, especially those of color who've been historically and systemically harmed and continue to experience poorer outcomes in care. And New Jersey's Medicaid program, New Jersey Family Care, covers about 1 in 3 births each year. So we have both a tremendous responsibility and a tremendous opportunity to turn the tide. The Medicaid reimbursement rates enhancements that we're announcing here today are another critical step to do so. These rate increases promote greater access to care for the Medicaid members we serve, and greater access is directly tied to improved birth outcomes. These reimbursement increases also make sure our rates are competitive, so we can retain and recruit high-quality perinatal providers and community doulas to be part of the Medicaid network. And with this step, I'd love to see every maternity care provider in the state be part of the Medicaid network. These enhancements will lead to positive outcomes for mothers and babies and a healthier New Jersey for everyone. And these changes stem in part from the feedback of parents we've talked to across the state, and from the advocacy of midwives and community doulas who are an integral part of our maternity care system. So as always, I thank you all for your advocacy and partnership. We will not make the progress we need to without you all at our table. Today's good news builds on several other critical steps we've taken in our shared effort to make New Jersey the healthiest place to have and raise a baby. In partnership with the First Lady, New Jersey Human Services is promoting high-quality care through the design and launch of a statewide perinatal episode of care pilot that's testing an alternative payment model tying outcomes and payment in prenatal, labor, and postpartum services, expanding family care coverage for moms and birthing people for a full year after delivery in order to improve postpartum care, making community doula care a covered family care benefit, and helping to build a statewide network of community doulas, allowing all licensed midwives to participate as New Jersey family care providers, ending reimbursements for early elective deliveries that aren't needed for a medical reason, which we know leads to poorer outcomes, requiring perinatal risk assessments during a member's prenatal care to help identify risk factors and healthcare needs, and working with our partners across government to support a variety of the recommendations in the First Lady's strategic plan, including the implementation of universal nurse home visiting and the establishment of New Jersey's Maternal Health Innovation Center. In New Jersey and across the nation, we will not improve systemic inequities in maternal and child health care and outcomes by doing the same things we always have. Here, under the First Lady's leadership, we are doing things differently and making the changes necessary to eliminate inequities in care. And we are putting the focus where it should be, the health of New Jersey's mothers and babies. Healthy moms with quality health care coverage, quite simply, promote healthy families. Thank you. And it is my pleasure to introduce Senator Turner as our next speaker. Senator Turner is a champion for working families and particularly mothers. She has authored the recently signed law permitting contraceptives to be available over the counter without a prescription, and was a prime sponsor of the law authorizing Medicaid to cover prescriptions for contraceptives for up to 12 months. She also sponsored the law eliminating premiums and waiting periods for children in New Jersey family care. And Senator Turner also authored the law appropriating $100 million to revitalize the child care industry through grant awards and a study of the child care landscape. So it is without question that you are a champion on these issues, and we're so glad to have you join us here today.
Good morning. This is more than a good morning. This is a great morning. And this is a morning that people in the state of New Jersey is going to be extremely grateful for. And I want to thank the First Lady as well as our governor for putting families at the center of his administration, because we all know that family is where it all starts and it's where it all ends. This is a cloudy day outside, but when my constituents and the constituents in New Jersey learn of this initiative, they're going to have sunshine in their faces. The maternal mortality crisis in the United States has been well documented. Among wealthy nations, the U.S. holds the highest rate of preventable maternal deaths. Currently, the World Health Organization ranks the United States as 55th in maternal deaths, with New Jersey being among the top 10 states with the highest rates of maternity deaths. Can you believe that? And that is why I'm so grateful to our First Lady, who has made this a real initiative to do something to change that. And we're all here today to support that change. For every 100,000 births in New Jersey, we experience 38.1 maternal deaths. 38.1 maternal deaths. Among Black mothers, that number increases to 102.3 deaths per 100,000 births. That is too drastic of a difference. We're going to change that with this initiative today. High maternal mortality is caused by the health disparities, which has impeded women's access to maternal health care. These health care disparities are manifested in racial, ethnic identities, linguistics, and other demographics. Lower income women of color have reported that they do not feel safe throughout their journey into motherhood because they are not well informed on maternal health and do not have access to maternal health in their communities. The Enhanced New Jersey Family Care Maternal Health Reimbursement Initiative will help provide adequate financing and support to ensure that maternal health providers such as doctors, midwives, and community doulas can provide women with comprehensive birthing assistance. For women of color, this means seeing providers who look like them, speak their native language, and understand and honor their cultural practices. It means having a dedicated team of maternal health providers that will improve safety, efficiency, and quality of health for our birthing mothers across the state. While our actions today represent a fraction of the solution to the maternal health crisis in New Jersey, I am confident that the Enhanced New Jersey Family Care Maternal Health Care Reimbursement will better equip our medical providers, our healthcare partners, and community doulas in the fight to advance maternal health outcomes here in the great state of New Jersey. We've got to do better, and we will do better with this initiative and also with the commitment of Governor Murphy and the leadership of First Lady Tammy Murphy. We will get it done. Thank you.
Good morning, everyone. So nice to see all of you here. Thanks for coming today. I am Julie Blumenfeld. I am a midwife, and I've practiced clinically at Capitol Health, serving the community in Trenton for more than 2 decades. Additionally, I'm the program director for the midwifery program at Rutgers University in Newark, and I represent midwives as the New Jersey president of the American College of Nurse Midwives. This significant increase in reimbursement rates in New Jersey family care for midwifery, perinatal, and community doula care is part of a continuum of innovation, impactful and sustainable work by Governor Murphy and First Lady Tammy Murphy to make New Jersey the safest, most equitable state to deliver and raise a baby. I want to thank them and Commissioner Adelman for her team at the Department of Human Services for this intentional and thoughtful step toward advancing racial equity and perinatal health policy. In particular, midwives in New Jersey are celebrating these enhancements as a huge win for women, pregnant people, and their babies in New Jersey. For the first time in New Jersey, all services covered within New Jersey Family Care will be reimbursed at the same rate, whether provided by physicians or midwives, making the midwifery model of care with proven positive outcomes more accessible to all. Evidence supports increased use of midwifery model of care to improve public health. Scaling up midwifery and increasing access to this model of care is a sound strategy to improving perinatal health outcomes in New Jersey and nationally. Capitol Health clearly has been visionary in its ongoing investment in midwifery. There have been midwives caring for patients at Capitol Health for decades. Historically, midwives have attended more than half of the vaginal births here at Capitol Health, and the hospital administration continues to grow and expand its midwifery service, including due to state funding, and again, thanks to our governor and First Lady, partnering with Rutgers, the State University of New Jersey, to train midwifery students to expand and diversify the midwifery workforce. I look forward to continuing to partner with our administration as we build on the many and vast accomplishments made over the past several years to improve perinatal health outcomes and decrease inequities in our great state of New Jersey. And I want to introduce my community midwife colleague, Tanique Griffin, who has a few words to share with all of you. Thank you very much.
Hello, good morning. First, I would like to express my utmost appreciation to the First Lady, Mrs. Murphy, and also to Mr. Murphy for having the initiative to address New Jersey's maternal mortality crisis. I'm a product of one of New Jersey's pilot doula certification cohorts out of Newark in October of 2018 in collaboration with the statewide Parent Advocacy Network. I supported my first birth in January 2019, and I must say, from then to now, there has been significant legislation and awareness that speaks to the impact that community doulas makes in addressing maternal health outcomes. Since Nurture New Jersey was announced, and I was in the State House back in March of 2019 when Governor Murphy announced that he was making a budget for maternal health. But since then, it's been innovative, systematic changes have been happening. Coverage for community doulas with Medicaid and the MCOs launched in January of 2021, and I've been there supporting families who otherwise could not afford doula support. I realized the new why disparities exist, not just for doulas, but other providers who accept Medicaid because of comparable compensation. Today's press conference demonstrates New Jersey's deliberate focus to effectuate New Jersey's maternal health care community more equitably. On behalf of all Medicaid credentialed doulas, not just here in New Jersey, but across the nation, we thank you, Madam First Lady, and the state of New Jersey for recognizing our value. New Jersey is being closely watched for how to implement Medicaid doula benefits for several states. Let's show them how it's done.
press that with me?
Yes.
Thank you.
How are you? Good, good.